அருள் புரிவாய் கருணை கடலே, அருள் புரிவாய் கருணை கடலே, ஆருயிரனைத்தும் அமர வாழ்வில் பெறவே அருள் புரிவாய் கருணை கடலே, ஆருயிரனைத்தும் அமர வாழ்வில் பெறவே அருள் புரிவாய் கருணை கடலே, பரிபூர்ண சதானந்த வாரியே, பரிபூர்ண சதானந்த வாரியே, பக்தரக்ஷகனே பரமாத்மனே, பக்தரக்ஷகனே பரமாத்மனே, அருள் புரிவாய் கருணை கடலே, அருணோதயம் போல் ஆத்ம சாந்தியும் அறிவும் மெய்யன்பும் திருவும் தருவாய், அருணோதயம் போல் ஆத்ம சாந்தியும் அறிவும் மெய்யன்பும் திருவும் தருவாய், தரும பயிர் வாழும் தருணமாமழையே, தங்குலமெங்கிலும் மங்களம் பொங்கவே, தரும பயிர் வாழும் தருணமாமழையே, தங்குலமெங்கிலும் மங்களம் பொங்கவே அருள் புரிவாய் கருணை கடலே, ஆருயிரனைத்தும் அமர வாழ்வு பெறவே அருள் புரிவாய் கருணை கடலே.
Thank you so much. Ranjini ji has been with the group for very many years and helped us sing also. We have had some yeah, she's our group singer. So you will be giving the introduction. Yeah. So I would like to request.
Let's make few.
Okay.
Yeah, let's make few announcements. July 2nd week we have a temple anniversary, so the meeting is to be on the 3rd week, and that will be picnic, subject to the weather. If it's 100 degrees, I'm sure we don't want to come out of home, but we will try to do the same place, 11 to 2. So we are done little early, not sitting in a heat. And then we have a Yoga International Day next Saturday from 8 to 11, right?
Yeah.
8 to 11. Please try to attend that. There's several speakers and the yogis are coming to show things, and meditation I think we are doing.
Kamlesh ji. So I think you have all met Sudha ji. She is the president of HCCC. So we are very happy that she is here. Would you like to add any details on the upcoming programs?
Yeah.
Okay.
I don't know the details. I did not ask him.
Our own yoga teacher Kamlesh ji is coordinating that event. There are a lot of organizations that are coming together to teach breathing techniques and light yoga, and maybe the chair yoga also is there like regularly. Whoever comes to yoga, please plan on attending it. Bring your friends as well. And we are fortunate to have Nilanjana ji and Partha ji, and I know you are associated with Alzheimer's Association for a long time. We just happened to finish the rodeo. The behind us was the local Livermore chapter Alzheimer's Association. The float is happening. It was touching to see like your passion and you bringing all these ones. Sooner or later, we'll become the senior citizens and we all need yeah, all these techniques and help you guys are going to provide us today. Thank you so much, and sincere gratitude and thanks to you and Parthaji. Thank you. Parthaji, you want to talk about Nilanjana ji?
Good morning, everyone. Thanks for coming this morning. It's very appropriate that we are doing this event in June, because June is designated as the Alzheimer's and Brain Health Awareness Month. So it's very appropriate that we have Nilanjana talking on that subject today. My name is Partha Parthasarathi. I've been involved in the temple from the very early days and served in a lot of different roles. But today I'm wearing two hats. I'm also volunteering, an active volunteer with the Alzheimer's Association. I've been doing it for about 10 years in various capacities. I used to facilitate a support group for the caregivers. We do some community outreach like we are doing here today. We do advocacy work. We work with the elected representatives to make sure government funds provide sufficient funds for Alzheimer's research and helping families. And of course, we also do fundraising. Without funds, we can't do anything. And talking about fundraising, every October we have a walk in the East Bay. It's held at the Bishop Branch. I don't remember the exact date. It's a Saturday in October. That's a kind of fun event too. You know, when you talk about Alzheimer's, we always think it's very somber and sad, but you know, this is the time to meet each other, people who are, share common experiences and talk about, you know, each other's concerns. So that's pretty good. Yeah. Like I said, I started volunteering in 2014. So I lost my mother to dementia in India in 2014. So at that time, I didn't know anything about dementia or Alzheimer's. And we were struggling to figure out how to take care of her. And we didn't have the benefit of people like Nilanjana in those days to advise us how to take care of the family. You know, there's no cure or treatment. Even today, we're still beginning in that direction. But the main thing is, how do you manage someone suffering from this disease? They don't know what's going on. And the people around us, whether it's spouse or children, they're at a loss to figure out what to do. It's very frustrating. Sometimes you get angry, and sometimes you just don't know what to do. You know, like they say here, you're pulling your hair, basically. So, things have made a lot of progress in the last 10 years, and hopefully things will accelerate and we will get to a point where we can say, yeah, we have a cure. We have to get to a point like we have gotten cancer or heart disease where there's a very specific regimens how to take care of it, how to treat, how to cure. So we are not there yet. So we have a lot of work to do in that regard. I'll keep my part very brief, and before I turn it over to Nilanjana, I just wanted to share a couple of things. Wait a second. No, we do. That's right. No, this is good enough. Yeah. As I said, the main goal, the long-term goal, is to find a cure for Alzheimer's and dementia. There are a number of aspects to it, of course. One is to accelerating research. When we say research to find medications for cure and treatment, but also research to get early diagnosis. The key to treating Alzheimer's at this time is to have early diagnosis. By the time the symptoms start, a lot of damage has already occurred in your brain, at least for 10 years or even more. So early diagnosis is very important because even the drugs that are currently approved by FDA are effective only if given in the very early stages. So early diagnosis is a very key part of the research. Now, there are some tools like PET scan and spinal tap, things like that, which are expensive and not easily accessible to everyone. So we need to get to a point where anybody can access these tools and get a diagnosis. And one of the things in our association we do, we try to help people with risk reduction. People ask, how do I prevent getting Alzheimer's? So there is no silver bullet for that. We talk about lifestyle, diet, exercise, being socially active, keep your mind occupied. There are a number of things you can do to slow the progression or slow the onset. So there are a number of training programs aimed towards that. Like we talked about early detection. And the biggest part of this is care and support. Like I said, when somebody in your family, your friends has dementia, people need to know, hey, what is it I do? What is the first thing I do? What are the things I take care of? There are a number of issues, right? Not only dealing with the patient, you got to worry about the financial aspects, legal aspects. If the person who got sick happens to be the head of the household and dealing with all the legal and financial matters, once they have dementia or Alzheimer's, then the family members need to know what to do. Either you can plan ahead of time, if not, then they need to know what else they can do. So a number of issues like that. Sometimes some people get violent, for example. Not very common, but some patients get violent. And people need to know, how do they handle this? People always have this debate, do I keep them at home or put them in a facility? So there are a number of issues in terms of caregiving, and so the association, a number of training programs, educational programs to deal with those. We got the next one.
Go to the next one.
The next one.
Yeah.
It's not a slide presentation.
No, this is not. Yeah.
Just go to the next one. Yeah. These are some statistics to show how severe the crisis is. As you see there were 7 million people in the U.S. living with Alzheimer's. I do have a lot of numbers for California, but for the sake of time, I'll just keep it at this level. And as you can see there, at this point in time, more people die of Alzheimer's than those dying of breast cancer and prostate cancer combined. Okay, so, and between 2000 and 2022, the number of deaths from heart disease came down, where death from Alzheimer's has significantly gone up. So we are doing pretty good with treating cancer and heart disease, other diseases. We still have a lot of work to do with Alzheimer's. So that's why there's a lot of work to be done still in terms of Alzheimer's. And lastly, yeah.
No print, better.
These are just some pictures taken at the last walk in Alzheimer's. So that's a good event. If you are living the East Bay, that's a good event to participate in. Okay. I won't take too much of your time, and it's time for me to introduce our speaker today. Nilanjana Maulik is no stranger to Bay Area. She's been here before. She's been at the temple. Everything. She's currently the Secretary General of the Alzheimer's and Related Disorders Society. of India in the Kolkata chapter. She's a fellow of the Commonwealth Association of Aging and a master trainer of dementia care skills from the Alzheimer's Disease International, London. She holds a triple master's degree in sociology and social anthropology from North Bengal University, management of human services from Brandeis University in the USA, and dementia studies from University of Stirling in the UK. Nilanjana started her work for people living with dementia about 30 years back, having been trained in dementia care at a dementia facility in the US. And working for several years there, she returned to India in the year 1999 to start the work in India. As a national awardee, Best Dementia Care Worker, it's a relentless search to improve the life of people living with dementia and their families that motivates her being. Welcome to our temple, Nilanjana. Thank you.
Just give me a few seconds, I'll yeah.
It's on, I think. I need to read
Just try. Hello, hello.
Thank you. Namaskar. Yes. That's the most difficult part, where you're putting me in one place. Because I always struggle with that. I'm someone who cannot really stand in one place.
No, it's okay.
Anyway, I will try my level.
I will move it back so you can stand. You can move around.
Sure. So, thank you. Thank you to the center, the community center, for giving me this opportunity to come and share my work, my experiences of what it is to live with dementia back home in India. So my focus will be totally from Indian perspective. Though Mr. Partha mentioned that I started my work here way back in the year 1994, but my work life has been mostly in India. And thank you, Parthaji, and of course Alzheimer's Association and Penning Chang for making this possible. So I don't live here. I live back in Kolkata, in India. My journey started here, like I said, 1994, and that was the year Ronald Reagan was diagnosed with Alzheimer's disease. And I was just finishing my master's, and my advisor suggested that I get into dementia, Alzheimer's. I was always interested in working with the elderly people, right from my childhood. I loved spending time with my grandma because I always felt that I learned a lot from her than from my friends my age. So I always had a fascination working with elderly people. So when I decided that I will represent the elderly population, he suggested that I get into dementia care because dementia is going to come as a big epidemic in coming years. And so that's what we see right now. So I started working at a daycare facility where people living with dementia came and spent their days. That's where I got my training, my understanding. And then on my trips back home, I realized in the late 90s, there wasn't much happening home. Families were struggling to the day-to-day challenges. And I felt that probably I need to go back and do something there. And that's year 1998, I decided to go back home, and I was planning to start an organization when I still remember 19th of September 2000, I read this article written by a lady. She was 83 years old, Shefali Chaudhary, and she was caring for her daughter, Deepika Basu, who was in her early 50s, just diagnosed with Alzheimer's disease. And as a mother, being in her 80s, she felt that yes, I am going through all the daily challenges, but I'm sure there are hundreds and thousands of families like me who are going through the same experiences and not knowing what to do. Because the doctor will give you the diagnosis and the medications, whatever is available, even after so many years. But then how do I face the challenges day to day? My daughter is not wanting to eat. How do I convince her to eat? My daughter has forgotten her way back home. How do I tackle this? So these were the practical challenges that she realized that she was going through, and she wanted to help more families. So imagine an 80-year-old thinking beyond her personal tragedy. And I felt that I needed to be with her, and I gave her a call, and we decided to come up with this organization, which is the Alzheimer's and Related Disorders Society of India. Now, this organization is a national organization back home, and in the year 2000, it was already existing in the southern part. So Cochin is where our headquarters are still now, and we have about 21 chapters all over India, and we started the Calcutta chapter in the year 2000. So our organization is purely focused on care and support for people with dementia. How do we support the family members and professionals like me? Because my training is absolutely like a professional. I have fortunately not have anybody in the family with the disease, so I really do not have any personal understanding of it. But my 30 years of really spending a lot of time with people living with dementia and their family members probably gives me a picture, a perspective of how not always difficult, but the challenges, the ups and downs that the family members go through, whether it's the spouse, whether it's the children, or whether it's a friend of that person. So my focus will absolutely be on the care that we have right now in India and how we came about doing it. So the organization, like I said, it's a registered society, and we have these various programs, and mostly all the chapters in India have similar kinds of programs. So we do a lot of awareness, because when we talk about dementia, when we talk about Alzheimer's, many of us kind of confuse what is dementia and how is it different from Alzheimer's. So very common questions like, what is dementia? So does my loved one have dementia or Alzheimer's, right? So awareness is very much needed to give you a clear understanding of what is dementia, what is Alzheimer's, and what are the warning signs. Because many a times we hear jokes that I think I'm developing dementia, where when we ask that person, what is your problem? And they'll say, I'm forgetting. But forgetfulness alone is not dementia. Dementia has a host of other signs and symptoms that comes along with the condition. So just forgetting is absolutely not just dementia. Because I'm sure in this hall, if I ask all of you, that is there anybody who will say, I do not forget anything? All of us, whatever our ages, yes, even a child, right? So forgetfulness is a very normal part of growing up and growing older. So do not worry if you are forgetting, unless and until you're forgetting consistently and things that you have been not forgetting and you should not forget. Basic things, right? Unfortunately, the forgetfulness in dementia starts like the normal forgetfulness, right? Where did I keep my eyeglasses? Where did I keep my pen? Or I forgot the appointment. These are normal forgetfulness or we have, right? Or maybe we get into the kitchen and we say, why did I come to the kitchen? right? So these are normal things that we experience day in and day out. But this is how our brain is structured. It is actually made so that it filters out information that is not needed. Otherwise, imagine from the day we were born till today, if we were forced to remember everything, we would not be able to, right? So the normal process of the brain is to filter out unnecessary information. And as we grow older, we prioritize what we want to remember and what we don't want to. Because a lot of times I will have children tell me that my mom doesn't remember what she had last night for dinner. And then I tell the daughter, why is it important to remember what she had for dinner last night? How is it really important, right? So as we age, we don't want to remember those unnecessary things. We want to remember things that give us joy, that gives us meaning, right? So normal forgetfulness and the kind of forgetfulness that you see in people with dementia are very different. But it starts in a similar pattern, but then it gets worse and worse. And with forgetfulness comes a lot of other symptoms. And that includes language problem, that includes disorientation, confusion, behavioral changes. And there are different types of dementia. So dementia is basically like an umbrella term that we use. It's a medical term that we use to describe host of symptoms. Say, for example, if you have fever, fever is not the disease. Fever is just a symptom that is telling that you have some problem in your body, some infection or some other kind of issues in your body going on. And fever is just one symptom. So similarly, dementia is a term that we use, professionals use to describe host of symptoms in a person. Forgetfulness, language issues, like I said. There are actually 10 warning signs of dementia. And one has to be aware of what those signs are, and if you are really seeing that in a person, you have to be careful whether it's really increasing, whether it's getting worse, and what kind, because in the various types that we have of dementia, Alzheimer's, which is the most common form of dementia, so we hear about that a lot. And in Alzheimer's disease, you tend to forget a lot, people, places, names, right? But you have come to another type of dementia, which is vascular dementia or frontotemporal dementia. The symptoms are very different. It doesn't really start with forgetfulness. It starts with behavior changes, because our frontal lobe of the brain helps us to regulate our behavior, what we should do, what we should say. Now, this part of the brain is helping you to behave in a certain way. Maybe right now, some of you are hungry and you want to go and eat, but you're not leaving because you want to stay here and be a part of this. So your brain, frontal brain, is telling you, I would rather stay here and listen to this. So it's kind of regulating your behavior. Now this part is damaged. You really cannot do anything about your behavior. Whatever you feel like, you will do it, right? You will feel like singing because you heard that lovely voice and you also want to sing. Even while I was hearing her, I also felt like singing, but I did not, because my brain is telling me that no, that is her part now, right? But if I were to develop frontotemporal dementia, I would do whatever I feel like. So there are different types of dementias, and it is very important to know the differentiations. Each of them come up with their own host of problems, and therefore the family members have to deal with these issues. So awareness is where we focus on all these information. What are the 10 warning signs? What are the different types of dementias? What are the risk factors? Age is one of the biggest risk factors of developing dementia. And age is something that is not in our hand. Even if we can, we may look in our 20s when we are in our 60s, but age is catching up, right? Every year it's increasing. And as you age, your chances of developing dementia increases. Not that you will have it, but your chances increases. So like that, there are other risk factors like family genetics, lifestyle diseases, which is a big risk factor now, being hypertensive, diabetic. These are huge risk factors for developing dementia. And we really have to work on keeping these numbers at a stop. Risk factors, and like Mr. Partha explained, the preventive parts, the tips. Basically, keeping yourself physically fit, eating well, sleeping well, because we hardly sleep well these days. Very, very important for your brain to sleep well. And keeping yourself mentally fit, keeping yourself mentally stimulated. And you have to not really stay in the past, but keep looking forward and keep doing things when you are learning new things. It is very important to learn new things. And it could be as simple as, stimulation could be as simple as using more of your left hand than your right hand if you are a right-hander. So your brain is basically thinking in a different way, because your brain is usually used to you doing it with your right hand, the work. So your brain is helping you do it. It is only getting stimulated if you're using the non-dominant hand. So things like these, if you can do, it really helps. So our awareness is focused on that. The screening part is where, like you go for your screening of whether you're diabetic or other kind of diseases, dementia screening is also there. There is a scale through which we can actually find out whether you have any kind of issues. So we do that. A trained psychologist or a trained person who is trained in doing the screening will go and do it. We have memory clinic where neurologists, psychiatrists, geriatricians, they will sit and they will do the diagnosis part. Counseling is very important. Mr. Partha informed that caregivers are the ones, the family, or whether they are professionals like me, we need a lot of counseling as to how we should really behave, communicate, and manage the daily challenges that we face. So counseling is where we do with the family, with the caregivers, and help them to achieve their goals. Training is totally focused on goals. So say for example, a professional caregiver will come and say, I have a lot of issues feeding the person that I'm caring for. So we train up that person how to feed effectively. So training is also a very important part of our work. And we have daycare center, we have home companionship program. So daycare center is a physical club where people with dementia come and spend the day there. This is not just physical care that we are doing. There's a lot of mental care, a lot of cognitive activities also taking place. So having a diagnosis of dementia does not mean it's the end of life. Just like any other diagnosis, any other disease, it's also a disease. And so your life does not end if you have a diagnosis of dementia. And believe me, in my 30 years of work, I actually have seen people with dementia make more sense than normal people. They actually have a better understanding of the world around them, not the way we think, but in their own reality, they have a very clear focus of what they want, how they want it. And our daycare center is a place where these people really come to have fun. Nobody is testing them. Nobody is telling them that, oh, you do not remember that. Oh, you what's wrong with you? Nobody is telling them that. Everybody is just having pure fun. That's the daycare center. Home companionship is for people who cannot come to the daycare. There are a lot of people, because of their logistical issues or their mobility issues, cannot really come to the center. So our trained companions would go and do that similar kind of activity-based work at the home setting. Caregiver support is something that we have every month. It's physical as well as online. Since COVID, we have started online. And we bring in various guest speakers who will talk about various aspects of taking care of dementia and also taking care of the person who is taking care. So caregiver support is so important because everybody is focused on caring for the person who has the disease, right? I remember 2003, I still remember the date. I was visiting a hospital a lady called me. Her husband had dementia and was hospitalized, and she told me, "Can you come, because my children are all abroad, and for them to come, it will take another couple of days. If you can just come and make sure everything is in place." So I visit her, and I see her sitting outside the hall, and I go up to her, and the first question I ask her is, "How is he doing?" And she looked up and she told me, "You see, everybody is asking about him. Nobody's asking about how I am doing." That was the day I realized that we're doing something wrong here. Of course, he needs the support, but what about this person? Day in and day out, 24 hours. Everything is around that person, whether he has eaten well, whether he has gone to the toilet, has he done this or that. And I have seen caregivers neglecting their own health. They forget their own medications. So caregiver support meet is a very important, that's the base. If we do not have that solid base, if I can really have strong mentally and physically trained, caregivers, then everything can be taken care of. But if I don't start with that, nothing will work. We also have lots of publications, books, leaflets. We have a documentary. I will try and share the documentary. It's about the whole experience. And so this is basically the kind of work that we are doing in India. I'll start with a couple of stories about these two beautiful people. On the left is Mrs. Kamala. She is 71 years old. And for the past few months, the family as well as the neighbors noticed that she was leaving the house every morning, around 6:30 in the morning, with a tiffin box in her hand. And so the family asked her, the husband asked her, that where are you going? What is this tiffin box in your hand? What is this all about? She hardly replied to them. She just walked out as if very, very sure that she knew where she was going. So the family followed her. The husband followed her along with the help. And along the way, they heard her smiling and talking to the passers-by, the neighbors, and telling them, "Oh, I'm getting late. My daughter class will begin very soon." Now, people who knew her knew that her daughter is 48 years old, does not live here, lives abroad, and that she has Alzheimer's disease. But this lady is still in that 1980s where she had to prepare the tiffin box and take her to her daughter in school. And she did not want to miss that hour, because if she did, then the daughter would go inside the class and not eat. So like us mothers, we want to ensure that the food is right on time. And she was still doing that. So in her reality, she was in her 80s and still very, very happy with doing what she was doing, right? So that's an experience if you are living with a type of dementia, and especially Alzheimer's, where your reality is very different from us. And what the family started doing was keeping her, kind of making her understand that you are not in that stage. Your daughter is settled abroad, she's old, you need not take any tiffin for her. Now, what happened was, when she heard that, she got really angry. And she started to hit people. And here it was where people were saying, "Oh, people with dementia become very violent." But people with dementia will never become violent unless and until it is triggered. Somebody is triggering their emotions. Somebody is triggering their thoughts and their feelings. Here I'm telling that I want to go and give this tiffin to my daughter, and somebody is telling me, "No, your daughter is no more, you don't need to do that." It's very difficult for people with dementia to relate to that reality that we are in. On the right-hand side is Mr. Rahman. He is about 81 years old, and Mr. Rahman loves wearing his watch, which is something that he cannot read anymore. I mean, he cannot really read the time, but he loves to wear the watch, and he always will show everybody that, this is my watch that my father gave me. And what we also saw with him was that he was behaving very differently from the personality that he was before. And the picture that you see is at our daycare center. Whenever he saw this doll, he would pick it up and he would cuddle and would sing and be so happy. So we would never stop him. We would, always. In fact, we would come up with stories like, "Oh, is he okay? You want to get any food for him?" And when we talked to his wife, the wife said that all I've heard that when he was growing up, he was taking care of his younger brother. And so this is his younger brother that he's taking care of. So he probably thinks that he's in his teens and he's taking care of his elder brother. So Mr. Rahman has frontotemporal dementia. Right now, he has a lot of behavioral issues where, for example, he will leave the toilet without any clothes. Because he really, that thing is gone, right? That, the appropriateness and the inappropriate things. So these are people, and along with them, we have about 8.8 million people living with dementia in India currently. And this is a study by AIMS Delhi and University of Southern California. And the alarming part is that 8.8 million today is going to go to 17 million by 2036, not very far from now, right? So India is going to see a huge jump in the number of elderly people living with dementia, not necessarily elderly, but people living with dementia in current years. If I go by the state, this is a very preliminary study again, nothing has been established and done, but what we are seeing is, you can see Jammu and Kashmir, where we see the prevalence, the incidence much higher than any other states. And people are, researchers are working on why there more. And a lot of the reasons are that the stress factor, everything is much higher there. So, and then Orissa and Bengal, where I belong, West Bengal is orange, and it's also going really, the numbers are really increasing, because when I started the work, I would have maybe one call in 3 months, to where we have at least 20, 25 calls a day now. So imagine the number of people that need help now.
Who are the
So-
green ones? Who are the green ones?
Sorry?
Green one. Green.
Punjab is
Bihar.
actually the green. So the green one is actually, the dark green is Chandigarh, no data yet from there. See, the difficult part of India is everybody speaks different language. The culture is different. Anything to achieve in India is not a matter of joke, right? Not everybody speaks the same language. So what scale and what literature that I prepare for people in Bengal, I cannot use that in Punjab or in other state. That is where, even in terms of diagnosis and treatment, it is becoming a huge problem. So it's not just a language problem, it's also rural and urban. If I go with the diagnosis, the screening paper, and I sit with a person from rural Bengal and I say, okay, draw a clock. There's a clock drawing in the when we do the screen. And they have not even come across a wall clock ever, right? So it doesn't make any sense. And if she fails, and I tell her that, well, I think you have dementia, that's wrong. So it is very difficult. So we are going through that process of where we are trying to come up with, more relevant ways. So globally, it's 51.6 million people living with dementia in the world now. And you see India, after China, which is 8.8 million. China is high up there, 13.1, and India 8.8. So it's more than people with Japan and the US.
What's the difference between dementia and Alzheimer's?
So, ma'am, dementia is a host of symptoms. It's a condition. It is caused by certain diseases in the brain, and one of the disease is Alzheimer's disease. So it is the Alzheimer's disease that is causing the dementia-like symptoms. So dementia is not a disease per se. It is a term that we use to describe a host of symptoms. Say, for example, if I say, I'm forgetting, I'm disoriented, I have language problem. So then the doctor will say, looks like you have dementia. Now then the doctor will go through a diagnosis, a process where they will find out what is causing those dementia symptoms in me. And that could be Alzheimer's disease in the brain that is causing that dementia symptoms, or it could be other, or it could be which we say reversible types, which is thyroid issues could also result in dementia-like symptoms. Or if you have a brain injury, then it can also cause dementia-like symptoms. So there are reversible causes of developing dementia. There are irreversible causes also. So the irreversible, sorry?
Is there any other test than the clock test?
Oh, no, the clock test is just one part of that whole test. So it takes about 15-20 minutes to do a screening, and it has all the areas of the brain that we test, orientation, language, recall. Say, for example, if I tell you all that I'm giving you 4 names right now, words, and at the end of the session I'm going to ask you those 4 names. So that's a test of recall. So these are the kind of things that are in that test. But the funny thing is that most people fail at that recall. They do great in all other areas, because and the other interesting part is that it's not that there is anything wrong with your brain. It's just that you did not listen to me well. And most of the time, that is the reason why we don't remember. Your daughter is telling you something, and you're busy doing something else, and then after 2-3 hours, you tell, okay, what did what do I have to do? And she would say, Ma, I told you that. Well, you did, but I did not listen then, right? So most of the time, we are a very bad listeners. We don't listen. We only want to say our part. So as somebody is speaking to me, I'm thinking what I'm going to reply, right? And that causes the most of the problem. So everything with your brain is fine. It's just that our attitude is one of the biggest factor that causes us to forget.
From this figure, can we make out that the number of the diagnostic person or doctor more the patient of Alzheimer's and dementia, because the services in USA is maximum for the elderly and dementia, so more the numbers. Maybe in Africa or India, maybe more doctors will treat, more diagnosis will be there.
Absolutely. As the awareness increases, see, एक समय था जब आप भूल जाते थे तो आपको बताते थे कि सटिया गया है, है कि नहीं?
Yes.
So it was taken as a normal part of aging to forget. But there's a fine difference between normal forgetfulness and the forgetfulness that is associated with dementia, types of dementia. That is where the doctors, as the medical professionals, are also, trying to understand it better and better, right? So, because it is anything to do with the brain is complicated. It's a very, very complex but amazing organ, but a very complex organ. So it's taking them time.
What age do you see the dementia symptoms?
So usually 65 plus, we see people developing dementia, that's the age. But it depends on the type of dementia. So a frontotemporal dementia, you could see even late 40s. We have a lady who comes to our daycare, she has frontotemporal, she's 49 years old. So vascular dementia, which is another type of dementia where the oxygen does not reach the brain and you have multiple infarcts in the brain, basically strokes, minute strokes in the brain, that causes dementia-like symptoms. That could be if you are hypertensive in your 50s. that can also cause it. And the difficult part is that, say for example, I'm standing here today and I'm talking and you see me, okay, this lady did the talk well. She could talk about all the slides, but maybe 5 years or 10 years down the road, you hear that I have developed dementia. Now you would say, how come this lady, she was okay, how come? Now, the funny part is that even though I am doing this okay, there are other areas in my life that I'm having problems, right? So dementia-like symptoms, actually the damage in the brain starts 8 to 10 years earlier. But with all the reserve that you already have in the brain, it's helping you to go on. So it doesn't develop, it will not develop yesterday and I will get diagnosis tomorrow. Actually, the process starts much earlier.
It started already, that's what.
Yes, it started. Probably it started already for me. So, yeah, you're right. Okay, so these are the numbers. Now, what are the growth factors? It's, of course, the aging population is increasing in India.
Longevity is more.
Absolutely. People are living longer. Our aging population by 2050, it's going to explode to 38 crores, which is 1 in every 5 Indians will be elderly over the age of 60. So India is still a young country, but it is going towards being old. And there are multiple risk factors in our genes, right? So we are the diabetic capital of the world. Most of the Asians have hypertension. Our dietary habits are, it was good early on what my grandma ate. I'm not eating that, right? So now in India, I go out to the the vegetable market and they will force me to buy avocado or broccoli, and I say, but that's not what I ate when I was growing up. But because you hear this is great, you're wanting to eat all this, but your body is not used to those. So sticking to what your body is used to, what you ate all along, is what you should be doing. But our dietary habits have changed. The younger generation is, just not going the right way. And of course, some of the genetic predisposition, and tobacco and alcohol use is also huge in India. So that's still a problem. And these are huge risk factors. So what are some of the challenging aspects of India? Number one is the family-driven model. Every family is so invested, so involved in the care of the loved one, which is hugely, positive on one end, but on the other end, they're struggling. They do not want to give up. Even if I go and tell them, ma'am, I am here, don't you worry. He will be fine under our care. Now, is he going to be okay? So she will call every 5 minutes to ensure that he's doing okay, right? So we are very, very invested in our family. And that's absolutely, and I think that's where our model is the best, and other countries should really learn from it. But we as Indians need to know how to balance the professional support as well as the family support. Because we will need it, believe me. When we were growing up, we grew up with family, joint family, but now it's not. So we need to really balance that. Very low awareness, late diagnosis. Late diagnosis and low awareness is not just in India or globally, but the level is much low in India. Even after so many years of work, we still have difficulties. Limited trained workforce. So, I will train a group of 30, 40 people at least 4 times a year. And out of that 40 or 50 people, maybe 2 or 3 will come out and say, ma'am, I want to join. I want to start caring. Because this is not, dementia care is very different from general caregiving. It's not that the person will tell you, okay, I am thirsty, give me a glass of water. You as a caregiver will have to understand that this person is thirsty or this person is hungry. So, very limited trained workforce. We are struggling, believe me. And of course, dementia-specific services are also very low. There is a gap in urban and rural. A lot of facilities available in the urban areas, not so much in the rural areas. There is also lack of standardized care protocols. So the way I follow the protocols in my center It's not like everybody's doing that, right? Everybody's doing their own way, which we know in India, that's how we do, right? Everybody does their own way. But certain times we realize that that's the huge difficulty. There's still lack of government support. Government still does not acknowledge that elderly problems should be India's on topmost list, because there are other issues that India has to deal with, right? And I have visited ministers where they have told me, Nilanjana, why do you think you are spending so much of time after the elderly people? Where are their children? Are they not looking? Why do you have to come in? So these are some of the questions we have to hear, right? They don't realize that India's structure, family structure has changed. So there's a lot of awareness also that needs to happen with the government. Stigma, social stigma is a huge issue. People don't want to say that my husband is forgetting and he's no longer. We had this professor from Berkeley. He was a retired World Health Organization official, and he was a professor of statistics at Berkeley University, and he developed Alzheimer's, and he came to our center. He was there for 6 years with us, and his wife struggled because here was this gentleman under whom he had hundreds of students who have done their PhD in statistics, mathematics, and here was this man who just could not solve 2 plus 2. His just brain didn't help him. Now, imagine the caregiver journey, right? Not able to share that with any of her family or friends that my husband, who was up there, is not able to do this. So, stigma in sharing the information. Cost and accessibility barrier is the biggest. Cost. How many people in India can afford paid services? 70% of the population in India lives in the rural areas. 30% is in the urban areas. And dementia does not affect people in the urban areas only. It can hit anyone across the system, irrespective of your ethnicity, of your caste, creed, financial background, educational background. So if I have to understand the cost in India, it varies by the severity of the condition. Urban household would spend anywhere between 45,000 to about 5 lakhs annually right now. Semi-rural household spends about 20 to 66,000 annually. The types of cost include the direct cost, which is medical expenses. Nothing is covered, right? In India, the government doesn't cover your health costs. So medical expenses, caregiving cost, which could be in-home, or it could be residential, or it could be daycare. Indirect cost is loss of income for caregivers. I have a lot of children or spouses come and tell me that I have to leave my job because I have to take care of him. And we keep telling them that, you could still continue your job and we are there to support you. But then, like I said, family-driven model. So somewhere they feel that if I'm not giving up and taking care, I'm actually not doing what I'm supposed to do. Hidden cost, which is a lot of times you will know that people with dementia have difficulty in maneuvering the environment, the physical environment that they're in. So a lot of times there needs to be home modifications, changes in the toilet, changes in the bedroom. So these are home modifications, and a lot of times the family members also need therapy for themselves to keep going in this journey. They cannot just give up and vanish. They have to be there till the person is there. So they also need a lot of therapy classes, which leads to expenses. So these are some of the costs in India we face. Just a couple of, I wanted to give you a narrative of the families, the way they navigate cost. This is a middle class, the number one case is middle class family struggle. It's a retired couple in Kolkata where the husband is diagnosed with dementia. The wife has no pension and their savings starts to come down due to caregiver cost and frequent hospital visits. Financial impact, they initially afforded private care, but lately they're relying on families to meet the cost. A rural caregiver burden in India. This is a farmer family in Odisha, where the grandmother has dementia. Challenges, no specialized care nearby, so they rely on untrained relatives. Financial impact is selling land for medical expenses, where they have to sell the land, come to the city for diagnosis and care. The wealthy family dilemma, An affluent businessman in Delhi whose father has dementia challenges the cost of premium daycare facilities is high, but they still struggle with emotional burnout on financial planning for long-term care. Financial impact, despite being wealthy, the unpredictability of dementia care drains the funds. So even if you have the money, it's anyone living with dementia can live anywhere between, depending on the type of dementia they have or any other comorbidity they have, they could live anywhere between 5 to 10 years. So imagine you have to continue spending the money all through these years.
That's the same problem, I think, here also in many cases.
Yes, yes. So what are the...
We have the same issues here in US too. It's
Yeah.
not just India.
Same problem.
Yeah, but that's what I think,
Insurance covering everything.
Yeah.
Right, and especially around mental health, right? There isn't much around support around mental health. That's a huge debate. So the available resources in India, there are memory clinics, assessment and diagnosis coming up, lot of interest coming up with any services and facilities around dementia, but still compared to the population, it's less. Geriatric and dementia care hospitals yet to start. Very few places that are absolutely specialized dementia care units or geriatric wards in hospitals. So most of the families will call us because the nurses and the doctors are not used to caring for a dementia patient. Say, for example, they had a pacemaker, or I had a recent family. The gentleman had an eye operation, cataract operation, and he was there for 2 days. And the nurses were struggling because here he's not realizing that he had cataract, right? So he's trying to scratch and do that. And when I went, his hands were tied because they are saying that, ma'am, we have to kind of decide what is the risk here and what's the benefit, right? So most of the hospitals do not have specialized training to look after elderly person. Even forget dementia. Even an elderly person goes into a hospital, that person will behave very differently from a 30-year-old. That person will need attention, will need somebody to come and say, how's everybody at home? But the nurses don't have time for that, right? They're struggling with finishing their duty. So this is a huge issue. Daycare and respite centers are coming up. Residential memory care homes are there. And there are a lot more national level organizations and helplines now. And if you want to find more information about wherever you are in your city, in India, Dementia Care Note is something where you could go, and they have state-wise, city-wise information. So Dementia Care Note is a directory that has been made by one of my friends, Swapna Kishore. She's based in Bangalore, and she has come up with this Dementia Care Note where we feed her with all the information that all the cities are doing, and she kind of has this page. So you could go type Dementia Care Notes and you'll get a lot of information. So what's the way forward? We have to expand a lot of geriatric infrastructure. How many colleges, universities have geriatric medicine as a specialization? Not many, right? So geriatric, even now a lot of times people will ask us, what is a geriatrician? What's a doctor? What's that kind of doctor, right? So I think that understanding that knowledge is yet to begin. Regulate care infrastructure. We do not have, like you have here, a regulation body who will go and monitor and evaluate the care system. That is lacking there. And we are trying to get that. Promote education and training for caregivers. Families will tell me, I know my husband so well, why do I need to get trained? True. I know, of course you know your husband more than I do, but he or she has dementia right now, which is causing all these issues, and I could help you to kind of navigate this journey. So we have to also educate family members that training is necessary. Public-private partnership is what we are trying to build in India. Any private organizations cannot do it all alone, neither can public bodies. So trying to come up as partners. Encourage family involvement and societal support. which is there. We keep encouraging. We encourage a lot of youngsters to come and participate in our activities. And that is where we promote the intergenerational bonding. Because that is somewhere, we are seeing people, young, especially mothers, they are more busy with ensuring that the child goes to some classes rather than spend time with the grandparents, right? So that is where we are kind of telling them that this is so very important. Life's greatest lessons will be learned from spending time with grandparents, not going to a coaching center. So, we keep doing that. So what are the key takeaways from whatever we understood? So both prevalence and care costs are projected to more than triple over the next 20 years. So there is an urgent need for us to invest in early detection and prevention. Public health awareness campaigns. We need to have a lot more awareness campaigns. Training and support system, and affordable dementia care services. We have to come up with structures where people can afford the care. You cannot come up with AC and lovely furnishings and tell them that we are giving you the best, but I'm only able to cater to very few people, right? So in India, nothing works if you are just catering to very few people. They can anyway afford. So like for our organization, we are coming up with this 24/7 care and residential home where we plan to have at least 25 beds for people who cannot afford. And the rest will go for people who can afford. Because otherwise, if we keep only looking at how much we can gain, then we will not. We feel that we are not doing justice. Now, this is a QR code that I would like, if you would want to, you can take a picture. This is a Google form basically. If you have any questions, any particular questions that you would want me to explore even after I'm gone, because I'll be gone end of July back home. I'm here for a few months just to visit my own family who lives here, but I live back home because of my work. So you can fill this form and submit, and I will get back to you. So you can always take a picture. That's all from my side, and I think I can take questions.
No, that was an excellent presentation. Thank you. I got one question.
Mm-hmm.
You mentioned about directory services. What's called
Dementia Care Notes.
Is there a website?
Yeah. No, it's not.
How do people get to that?
So all you need to do is Google. Dementia Care Notes is going to come up.
Oh, just Google.
Yeah.
Quick question.
Yes.
Once I will.
Do the dementia patient remember only the mother tongue?
So as the disease progresses, they only remember the mother tongue.
That's what
I was talking to a family last night, and the mother has been shifted to Bangalore, where Kannada is being spoken by all the caregivers, right? They have only one Bengali speaking, and this person is a Bengali lady. Only one caregiver who speaks Bengali, and what they have noticed is that she tends to look for that person. Because, yes.
Yeah, one of my nearest
Yeah.
family member is in that stage.
Yeah.
How can I help her? That's what.
So, basically, ma'am, in my understanding, a lot of times we focus on how to bring that person back to their, what they were. I think we spend a lot of time in thinking, how can I make that person how he or she was earlier? But rather than focusing on that, if you can enjoy the moment that person is in. So, exactly. So, what I feel my learning has been is that as people with all our mental abilities intact, hoping all our mental abilities are intact, we focus a lot on our future and the past. What is going to happen in the future or what has happened in the past? And thereby, we miss enjoying the present. People with dementia will teach you how to live in the present moment. Because they don't remember the past, neither they care about the future. They are you are right with them, you're talking to them, they are enjoying it. And they teach you, and I actually have learned that myself, that I have seen that a lot of times I would sit with somebody and I would think, okay, what am I going to have for lunch today? And they would pick up from my body language and say, what are you thinking? You're not listening to me. So people with dementia will surprise you with the abilities that they still have, believe me. They still have abilities. It is just that we as caregivers don't explore. We don't give them that opportunity. Because we have already assumed that this person has forgotten, this person cannot do this person cannot do that. The moment you come up with that attitude, what are you expecting from the other side? Nothing, right? And if I had the opportunity, I could show you pictures. I mean, right now, all my the club members are doing a project which we are going to present at an exhibition in the Indian Museum in September. And the amazing artwork that they're doing, you cannot imagine. So everybody, all of us are capable of something or the other. It's just that we are not explored, or we are not given the opportunity to explore it. So I think it's the same with people with dementia. So spending time with her, enjoying the moment with her is all you need to do.
Thank
Dementia people.
Any other
take drugs like ARDSI for Alzheimer's. Do they get any drugs also?
So all the irreversible types of dementia has 3 or 4 drugs available all over the world. And that's what the neurologist or a psychiatrist would use it. Psychiatrists would use more of antipsychotics, antidepressants. Neurologists would use this memory-related drugs, ARDSI, donamine, all the ones, the regular ones. There are only few, right, that are used. But then again, there are a lot of debate as to, whether it's really working or not, whether it's making any changes. Because, see, these drugs are for early stage stage. But most of if the diagnosis is done very late, and whether those drugs are at all helping. So as family members, we also, for family members, we also tell them that you note down, after starting this drug, whether it has helped, how much it has helped, so that you can go and tell the doctor, this is probably not helping, or it's really helping. So that way he or she can review it well. So there is a lot of education also that needs to happen because, in India, I don't know about here, but in India, they will come up with a prescription and I will ask them that, okay, why was this drug given to your husband? And they'll say, what drug, ma'am? The prescription is there, the drugs have been bought from the market, but the family did not go through the prescription. So, see, in India, the doctors don't have time to sit and explain, right? Okay, this drug is for this. They don't have time. They see 40 patients in 2 hours.
Same thing here also, right?
Same here.
Yeah.
Really?
Same here.
I think that's not the numbers that doctors see here.
Here only thing,
No.
the pharmacy, the medical says.
Pharmacy will explain.
I think what we would like to also I was listening in. Thank you so much. That was really, really, really insight for me. Because I have a 90-year-old father, okay? So for me, he cannot forget anything. Even due date, he is the best, right? And do you have any online courses for caregivers, okay?
Yeah.
Do you have that? Is
Yes.
there something that we can get?
course.
I think a lot of us are would like to understand that because I feel I am not a good caregiver because
Nobody is a good caregiver.
no, meaning I love that, but I see that you instinctively, right? You're not listening to me. Did you hear what I said? Can you repeat that? And especially if they're low on hearing, your tendency is to ask again and again. So that is one thing. But I wanted to ask, you had mentioned the challenges in India. Do you have the same challenges that we have here in US? Parthasji, do you have any insights for that?
Yes.
I think most of us here live here. So a few of us only may go back. But for us, understanding the care that is available here is very, very important.
The challenges are very similar, but it's a question of degree, right? like Nilanjana was saying, even though she has all these things, there's no awareness in India because it's such a large country with a lot of diversity. The word doesn't get around that people like Nilanjana are doing this great work and services are available. To a large degree, it's also true here. Again, like I said, it's a question of degree, right? Like Alzheimer's Association here tries to do meetings like this more often in more places, so more and more people are getting aware. Oh, by the way, I have some brochures on the table there that I brought with me. You can pick it up. In terms of training, if you're thinking about caring for somebody in this country here, alz.org, the website, has a lot of information there.
Okay.
If you have any difficulty navigating, let me know, I can help you out. But alz.org, a lot of information on training, various courses, a lot of information about the disease, medications.
So one thing I noticed is there is something like a selective forgetfulness, right? Like my father will remember the bank account number very well, or want to know the balance on his bank. But if I ask him what did you eat in the morning, he'll call his caregiver and say, what did I eat, right? That is very, how do you take care of that? Even for us, right? For me too, some things today morning I'm forgetting a restaurant name, but I remember everything else, right? So how do we improve that at our age? How do you take care of that?
I don't know, brain is, or brain, like she said, it's very complex organism. So it's very difficult to explain some of this. For example, right, they have found people with Alzheimer's and other dementia, they're very responsive to music, for example. The part of the brain that appreciates music or singing, for some reason, doesn't deteriorate. They're able to still recognize music that they heard in their age or whatever. And people who are not only not responsive when they listen to certain music, they suddenly brighten up in their faces. So some of these things are still, people are doing research to figure out why.
You said stimulating your brain, right? What kind of stimulations?
That's right.
Yeah.
Right. So I think there was one time when multitasking was encouraged a lot, right?
Not
But
anymore.
now, no more.
No more.
Because you are multitasking, you're forgetting.
Yeah.
So there was one time when it was supposedly good for the brain. So you do 10 things at one time and your brain is, but what they're seeing is that is not good for you.
No, well, that's an interview question we ask others. How good are you in multitasking? And I ask the question to everybody I interview for the job because that's a requirement of life now, right? We don't have the awareness to be in presence, like how you said, right? We are not taking time to enjoy. Like if I'm listening to your presentation, 100% I should do that. I'm pretty sure our mind is wandering everywhere. Right?
And it is normal and natural to wander. It's just that it is through, then that is when you have to really, if you really want to focus, you have to start meditating. You have to, and each like their own. You want to meditate for 10 minutes, you want to meditate for half an hour, but you will pick your own way of doing it, not what others are telling you. Also in your daily life, you pick what gives you joy. Somebody tells you puzzle is very good for your brain, but you don't enjoy doing that. It's not going to help you in any way. So I think if dancing is what you love, then do that. Yep. That's where your brain is really going to be motivated and stimulated. But I think multitasking is causing a lot of problems. In terms of men and women, I think men are very good at selective hearing. They can do it well. They do it well, it's not that their brain, anything wrong with their brain, it's just that they just want to listen to what they want to do. Okay, women are actually all out there, trying to do the good.
Women are good at multitasking than men.
So, I used to attend. Thank you so much. This brain, what you call mind related activities during my work, and
they also started saying two things. One is multitasking, which was encouraged in the past, is not good now. They want you to do single task one at a time. Absolutely. Focus. Second is this breathing exercises, not necessarily meditation, but that will calm down the brain. I think it looks like any articles, anything if we have about that, we can take it in your website.
Yeah, if you have links, we can share it to the group. Parthaji, the caregiving, and you said you had that. I would love to send it to you. At least you share a lot of them. Babaji is here. You would like to quickly share some thoughts.
Namaste. What you're seeing here is an example of service over self. Okay. Magic of Rotary. Okay. And you're personally seeing, because she's actively involved in helping the community, senior citizens with memory loss, she takes great pride in explaining that. So I just want to build on the great work she is doing.
Once again, I wanted to thank you, Bappa Kalu. He's been one of our long-term volunteer, and he's part of the Rotary. He said, wanted to give his thoughts about this. Thank you. This is Bhaskar Swaminathan. So thank you so much for coming here today.
Thank you.
Sarathi, Parthasarathi has been taking lead on this. Really appreciate your time, and also is coordinating from the entire event. We have been planning from last year. This year it's happened. Thank you so much.
I would like to call today's event coordinators Sumanji and Padmaja.
Everybody has to feed, no? We always want to thank our food chair, and he is here today. This year, without asking any questions, he come forward. We want to give a round of big applause for him. He's been phenomenal.
We got the tea today.
Yeah. He always comes with a smiley face. Thank you. Okay, Nilanjana, thank you so much. He has been doing a phenomenal job, irrespective of religious, non-religious, in small or big, he is there and is making sure that it reaches, message goes to every single volunteers and also constantly updated. This has not happened in the history of HCCC. I don't know who is going to maintain the history at the same level. Big round of applause and thank you for Raj Vellamani.
My pleasure, sir. Thank you very much.
Thank you so much.
Just want to make sure the second Saturday there is no meeting for July. The 3rd we have a picnic. So remember that there's a Yoga International Day next Saturday from 8 to 11. Anything else?
So we'll do a closing prayer.
Yes. Pushpaji.
Thank you, sir. Thank you.
Sahano Bhunaktu Sahaviryam Karavahai Tejasvinavadhitamastu ma Vidvishavahai. Om Shanti Shanti Shanti.